The journey to medical school is paved with challenging exams, and the UCAT is no exception. Among its many hurdles, the decision-making section stands out as a unique test of your critical thinking and problem-solving abilities. This section goes beyond rote memorization. It assesses your capacity to analyze information swiftly and accurately under pressure. Why is this so crucial for aspiring medical professionals? Because every day, doctors face complex situations demanding quick, logical decisions that directly impact patients' lives. Acing this section isn't just about earning a good score. It's about demonstrating your potential to handle the real-world scenarios that await you in medical school and beyond. It's about showcasing your ability to think critically, evaluate information effectively, and make sound judgments, skills that are paramount in the medical profession. So, how do you conquer this crucial section and prove you have what it takes? The UCAT decision-making section is specifically designed to assess your analytical and logical reasoning skills. Unlike other sections that focus on knowledge recall, this section presents you with a series of puzzles, arguments, and data sets. Your task? To decipher this information, identify patterns, and draw logical conclusions. Imagine being presented with a complex medical case with various symptoms, test results, and patient history. Your role is to connect the dots, rule out possibilities, and arrive at the most probable diagnosis. This is precisely the kind of analytical thinking the decision-making section aims to evaluate. It's about evaluating arguments, weighing evidence, and making sound judgments based on incomplete information. This section comprises various question types, including logical puzzles, interpreting data from charts and graphs, assessing the strength of arguments, and calculating probabilities. Each question type presents unique challenges and requires specific strategies for success. The UCAT decision-making section is notorious for its time pressure. With only 31 minutes to answer 29 questions, you have slightly over a minute per question. This time crunch can be incredibly daunting, especially when faced with complex data sets or intricate logical puzzles. It's easy to feel overwhelmed and rushed, leading to careless mistakes. But don't panic. The key to success lies in understanding the time constraint and developing effective strategies to manage it. One effective strategy is to practice with a timer to simulate exam conditions and build your speed and accuracy. Familiarize yourself with the different question formats to anticipate the challenges and develop a systematic approach to tackle them. Remember, the goal is not just to answer questions, but to answer them correctly within the given time frame. By practicing regularly and refining your time management skills, you can overcome the time pressure and approach the section with confidence. Logical puzzles can seem intimidating, but they become much more manageable with the right approach. Often, the key to solving these puzzles lies in breaking down the information into smaller, more digestible parts. One highly effective tool for deciphering these puzzles is the Venn diagram. This method is particularly useful when dealing with problems that involve sets and their relationships. These simple yet powerful diagrams allow you to visually represent sets and their relationships, making it easier to identify overlaps, exclusions, and deductions. By organizing the information visually, you can see connections that might not be immediately obvious. For instance, imagine a question about a group of students, some studying biology, some studying chemistry, and some studying both. This scenario can be complex, but a Venn diagram simplifies it. A Venn diagram can help you quickly visualize these groups and determine the number of students studying only one subject or both. It provides a clear picture of how the groups intersect and where they stand alone. The key is to practice translating the information provided in the question into a clear and concise Venn diagram. This skill can be honed with regular practice and application. This visual representation allows you to quickly identify the relationships between different groups and make accurate deductions. It turns abstract data into something concrete and understandable. Remember, the UCAT decision-making section is not about complex mathematical calculations, but rather about logical reasoning and deduction. It's about understanding the relationships and making informed decisions. By mastering the art of Venn diagrams, you can unlock the solutions to even the most challenging logical puzzles. This tool can be your secret weapon in tackling the UCAT and beyond. Section 5. Data decryption, interpreting charts and graphs. Data interpretation is another crucial aspect of the UCAT decision-making section. This section tests your ability to understand and analyze data presented in various formats. You'll encounter various charts, graphs, and tables presenting data that you need to analyze and interpret accurately. These visual tools are designed to test your ability to extract relevant information quickly. The key here is not to be intimidated by the sheer volume of information, but to approach it strategically. Breaking down the data into manageable parts can make the task less daunting. Begin by carefully reading the question and identifying the specific information you need to extract from the data. This initial step is crucial for setting the right direction for your analysis. Next, examine the chart or graph, paying close attention to the axes, labels, and units of measurement. These elements provide essential context for understanding the data. Look for trends, patterns, and outliers in the data. Identifying these can help you make sense of the information and draw accurate conclusions. For example, if a graph shows a steady increase in patient admissions over a particular period, you can infer that something significant might be contributing to this trend. This could be a seasonal illness or a new treatment protocol. The ability to quickly and accurately interpret data is crucial in a medical setting, where doctors often rely on charts and graphs to monitor patient progress, analyze test results, and make informed treatment decisions. This skill is not just for exams, but is a vital part of medical practice. By developing your data interpretation skills, you'll be well equipped to handle the challenges of both the UCAT and your future medical career. Mastering this skill will give you a significant advantage in your studies and professional life. Section 6. Probability power, predicting the outcome. Probability questions in the UCAT. Decision-making section assess your ability to evaluate different outcomes and determine their likelihood. These questions are designed to test your logical reasoning and analytical skills. These questions often involve real-world scenarios, such as the probability of a patient developing a certain condition based on their medical history and risk factors. Understanding these scenarios can help you make informed decisions in a medical context. To tackle these questions effectively, you need a basic understanding of probability concepts, such as calculating the probability of independent and dependent events. This foundational knowledge is crucial for solving these problems accurately. Don't let the word probability scare you. With practice and the right approach, you can master these questions. The UCAT won't require you to solve complex equations. Instead, it focuses on your ability to apply basic probability principles to different scenarios. Instead, focus on understanding the fundamental principles of probability and how to apply them to real-world scenarios. This practical application is key to success. Practice with different types of probability questions, such as calculating the probability of drawing a specific card from a deck. This will help you become more familiar with various probability problems, or the likelihood of inheriting a particular trait. These examples illustrate how probability is used in everyday life and in medical contexts. The more comfortable you become with these concepts, the better equipped you'll be to tackle probability questions in the UCAT and beyond. Confidence and practice are your best tools for success. Section 7. The elimination equation, your secret weapon. Time management is paramount in the UCAT decision-making section, and the elimination method can be your secret weapon. When faced with a multiple-choice question, don't jump into trying to find the correct answer immediately. Instead, start by eliminating the answer choices that are clearly incorrect. This strategic approach has two significant advantages. First, it narrows down your options, increasing your chances of selecting the correct answer. Second, it saves valuable time that you can allocate to more challenging questions. The key to effective elimination is to identify the flaws or inconsistencies in each answer choice. Look for answer choices that contradict the information provided in the question stem, violate basic logical principles, or are simply nonsensical. By systematically eliminating incorrect answers, you can significantly improve your accuracy and efficiency in the UCAT decision-making section. Remember, sometimes the most straightforward strategies can be the most effective. Section 8. Conquering UCAT. Decision-making. You've got this. Mastering the UCAT decision-making section is no easy feat, but it is achievable with the right approach and dedicated effort. Remember, this section is not about rote memorization, but about honing your critical thinking, logical reasoning, and data interpretation skills. Embrace the challenge and approach it with a positive attitude and a willingness to learn. Practice consistently, review your mistakes, and seek clarification when needed. Use the strategies outlined in this essay, such as utilizing Venn diagrams, mastering data interpretation, understanding probability concepts, and leveraging the elimination method. Remember, the UKAT is just one step in your journey to becoming a medical professional. By developing your critical thinking and decision-making abilities, you'll be well prepared not only for the exam, but also for the challenges and rewards of a fulfilling medical career.